I bring you a summary of Chapter 6 of the Art Therapy Handbook, Individual Art Therapy. This chapter explains in detail in the process of working with individual clients, especially children, in art therapy, providing theoretical background, case studies in the case of John, an 8-year-old boy, and the evaluation and implementation process of art therapy. The following is a summary of the sections of this chapter. First of all, let's talk about the theoretical background of individual clients in art therapy. The chapter begins with an introduction to how art therapy can be applied to individual clients, citing several case studies that illustrate how art therapy can be implemented in different clinical settings. Many art therapists employed psychoanalytic frameworks to understand the dynamics of the therapeutic process, such as resistance, negative therapeutic reaction, acting out, interpretation, and insight. These concepts were first proposed by Freud and have since been applied more broadly to different schools of therapy, such as the Jungian or Kleinian schools. The main case studies in this chapter focuses on John, an 8-year-old boy, who described his art therapy process. Groups who are eligible for art therapy. Art therapy is mainly suitable for clients who have difficulty communicating non-verbally, such as people with limited language and communication skills. For example, children with the autism, children with emotional and behavioral disorders, people who suffer from trauma, depression, or psychotic disorders. Art therapy provides a non-verbal means of expression that allows patients to express their experience and emotions through image creation. In the assessment process, the assessment process usually begins with a family meeting in order to get a complete picture of the children's background. John's assessment was a combination of the school, the psychologist, his mother, and the art therapist, and his father did not participate. The section helped the mother voice her concern about John's behavior issues and allowed the therapist to assess the impact of the family background on the child. The key observation point to evaluate the section is to observe how your child uses art materials such as painting or clay. Observe your child's nonverbal communication style and observe whether your child's play behavior reflects his or her psychological state, for example, anxiety and aggression. In John's art therapy process, the initial meeting, John was so anxious and restless during the initial meeting that he was reluctant to sit still and began to explore the healing space with car toys. After gradually embarrassing art therapists, he experimented with painting and proposed the use of clay. He was clearly conflicted and bitter about the separation of his parents. At the initial treatment relationship is established, John began to express himself through games and artistic activities, such as raising cars and chains to symbolize a sense of control and security. His words reflect the influence of family divisions on him, such as making clay faces that symbolize mom, dad, and child, and adding blue tears to child, alluding to his sadness and loss. At the in-depth treatment. Over the course of his next few sections, his creation gradually became more complex, such as the creative expression, symbolism, and the use of the color. He made crocodile mother and babies and described them as being attacked, reflecting his anxiety about his mother and his own situation. And he also made the image of the hunter to symbolize the struggle of his parents for custody. He tried to mix colors but is confused, symbolizing his internal ambivalence. Depending on the therapeutic relationship, John gradually found an outlet for emotional catharsis in his artistic creation, reducing aggressive behavior. He began to explore the theme of in the middle in his therapy, symbolize his dilemma in his parental relationships. In the course of the treatment, key elements: the silence and nonverbal communication. The therapist observed how John chose the materials and words with him and waits patiently for his expression rather than intervening directly. John's work allows the therapist to feel his inner conflict, and the therapist better understands John's state of mind by reflecting on his own emotional experience. And finally, John initially wanted everything to be right, but gradually learned to accept imperfections and allowed emotions to flow freely. At the end phrase, John gradually realized that his treatment was coming to an end, and he began to consciously do the final piece. For example, he made an airplane that symbolized his sense of uncertainty about the future. John chose to take some of his words with him and leave others behind. This symbolized his ability to emotionally let go of certain aspects of his past while taking away the parts that are meaningful to him. After treatment, his anxiety and aggression were significantly reduced, and his family relationships improved. His mother was able to better understand how he felt about his parents' divorce and provided more emotional support. So, in this conclusion, art therapy is not just about creating, but also about how to express, process emotions, and build resilience through the nonverbal means. Through the arts, individuals can present their emotional states in a symbolic way and gradually understand and integrate their own experience. Ending treatment is also a part of treatment, and a reasonable way to end it can help individuals better internalize the treatment experience and move forward with growth. This chapter provides an in-depth look at the process of evaluation, implementation, and course of art therapy in the form of case studies. John's case shows how child can find ways to express and regulate their emotions through art therapy in the trauma of their parents' divorce. This process emphasizes the importance of nonverbal communication, explores the role of the therapist in the face of complex emotions, and shows how art therapy can help individuals integrate inner experience and ultimately achieve psychological growth and recovery. Thank you for watching, and we look forward to seeing you in the next chapter.